Good morning, everybody, and welcome to this MEDA Breakfast, our first in-person community event in about 3 years. Thank you Yay! Thank you so much for joining us this morning. I'm really delighted to be here with you. I'm Leslie Bernstein, the chair of the board of the Multi-Service Eating Disorders Association, as we say, MEDA. Monica Ostroff, MEDA's executive director, and I are so grateful that you're going to spend the next hour hearing about and helping our entire team make a genuine impact on this mental health issue. Can you hear me okay? Okay. First, a huge thank you to our Hope and Inspiration sponsors, AIS, the Village Bank, Calaire Properties, Cambridge Savings Bank, Roberta Cohn, Karen DeMoulis and Joe Pasquale, James Collis, the law firm of McDermott, Will & Emery, Seaport Capital, and the Weissman Family Charitable Foundation. Also, thank you to our outreach and impact sponsors. At all levels, we're so appreciative and recognize we couldn't continue without your generous support. And if you've already donated for today and sitting enjoying breakfast, thank you, thank you, thank you. I also want to recognize here today MEDA's representative to the United States Congress, Jake Auchincloss. Thank you for coming, Congressman, and paying close attention to mental health. This morning, we're going to hear from 3 individuals who are important to MEDA about their connection to mental health. We'll hear about the theme of addressing stigma, and also from our executive director, Monica, who, I have to just say a few words, has led the organization with dedication and passion and amazing amounts of energy to reach an incredible height. MEDA is a very important New England resource and continues to be relevant in these changing times, thanks in large part to Monica's creativity, expertise, and willingness to put the eating disorder patient at the core of what we do. Thank you. So, briefly, I just want to update you on the growth and transitions MEDA has gone through since we were last together. The biggest change is that MEDA directly treats people now with eating disorders or disordered eating behavior, as well as provides support services for family members and loved ones. We are in network with most insurance companies, including Medicare, and we can bill PPO plans for the few that we're not yet in network with. Our clinical staff, licensed social workers, has grown to 8 strong, adding 3 new clinicians in just the last 6 months. We moved to a new space with windows. It is T and bus accessible. We're still primarily working remotely. One of our clinicians is treating clients sort of hybrid, but we are ready when everybody is ready to return to in-person sessions. Our operations teams has also expanded, and the office is busier than ever. While we are all motivated by this growth of the organization, the reason behind it is not so sunny. You've heard these statistics before. Eating disorders are among the deadliest mental illnesses, second only to opioid overdose. Anorexia specifically has the highest mortality rate of all psychiatric diseases. Over 10,000 deaths each year are the direct result of an eating disorder, which the math works out to 1 death every 52 minutes. 26% of people with eating disorders attempt suicide. There are many, many varieties of eating disorders. You'll hear about that more later. Affect all people. In 2022, the most common eating disorder in the United States is BED, or binge eating disorder. And according to our sister our organization, MEDA, 44% of people with an eating disorder do not know where to seek help. And this is where we come in. MEDA has clinical services that include assessments, individual therapy, free recovery drop-in groups, therapy groups. We help families and loved ones navigate what is most often an extremely stressful and confusing time. We have skill coaching sessions that help clients make tangible progress with their behaviors. The fact that we've hired more clinicians has helped us move our wait list from about 125 in early summer to 20 now. That's still not great, but we're working on it, directly treating clients and families. Our team has answered over 1,400 phone calls and our groups have served about 1,500 people just this past fiscal year. We launched, very excitingly, we launched a new online resource tool called the MEDA Recovery Community about a year ago. It's the next best thing to a personal recovery coach, and it's available to people 24/7 as long as they have a smart device. I am incredibly proud of MEDA for designing and maintaining this important go-to recovery site. We have over 900 members, although closer to 1,000, you said, right? Most who have access to the site and all the resources at no cost. We hear about health equity so much in the media when it comes to COVID, to asthma, reproductive rights, and certainly mental health. I feel that MEDA is, with this resource, with this recovery community, we're positively contributing to this social justice issue by having these individuals, mainly in the lower socioeconomic status, get free access to the help that they need for recovery. In terms of advocacy, MEDA aligns with other organizations to support bills and laws and awareness of eating disorders. Early in the pandemic, our founder wrote a petition for TikTok to monitor its content for the majority of its users between 16 and 24 who were able to see drastic diet tips and weight stigma promotion. The petition had over 18,000 signatures. We have an entire arm of MEDA that's dedicated to training professionals. We have some of our wonderful professionals here today joining us. We are dedicated to training professionals in the etiology and treatment of eating disorders. Yet another way that we have impact. We help train more providers who can then treat this prevalent disease. We have an academic professional conference that had about 300 attendees last spring, right here, Newton Marriott. And Monica is creating both online and in-person trainings that people will be able to refer to. Other trainings and presentation this past year alone have helped us reach a total of about 2,000 mental health professionals. On the business side, due to the health and growth of our transitioning organization, the board is expanding, as well as engaging in a strategic planning process, ensuring the future sustainability for MEDA. The last important feature of the new MEDA that I want to mention is the establishment of the Memorial Scholarship Program in 2021 by the generous Sullivan family. Due to the lack of diversity in mental health providers and therefore lack of specific help for Black and Indigenous people of color, MEDA developed a fund to provide opportunity for BIPOC students entering the field of mental health, giving them financial assistance to get the schooling that they need and free access to all MEDA's professional trainings. To date, we've awarded about $23,000. Last year, which was the inaugural year, we had 5 applicants. Mimi Cole was one of the two recipients of the grant, and she is graduated to be a therapist, eating disorder specialist. She has a huge following on Instagram as The Lovely Becoming, and was recently quoted in the New York Times. Fast forward to 2022, there were 26 applicants, and 5 scholars were granted money for college or graduate school. I now have the honor to introduce our first speaker and one of those 5 recipients, Calvin Williams. Hold on. I want to tell them a little bit about you first. Calvin's a PhD student in psychology at Old Dominion University in Virginia, with experience as a health and education teacher in Norfolk Public Schools, a recent clinical mental health intern at Chesapeake Regional Medical Center. Calvin helped individuals with mental health disorders learn to cope with symptoms using evidence-based counseling techniques. He has chosen to enter the counseling field as a professional because of his own family's history with mental health disorders. It is my absolute pleasure to introduce Calvin Williams.
Good morning, everyone. First of all, I'd like to thank everyone for being here and inviting me to Boston. This is my first time in Boston, so I'd like to just thank everyone. And I'm grateful for organizations like the Multi-Service Eating Disorders Association, and also for leaders like Monica, Ruth, Carolyn, and Rebecca, just to name a few of the brilliant people who involved with this company, and people who have dedicated their lives to helping people overcome eating disorders, which has one of the highest mortality rates of any psychiatric disorder. I was overjoyed after learning that I was the recipient of this scholarship. It was a blessing in disguise that actually gave me the confidence and the motivation to apply for the doctoral program because I don't know how else I would have afforded it. Um, and honestly, I was exhausted with, taking out student loans but I was really willing to go into further debt to reach my educational goals before MEDA stepped in and provided me with the opportunity of a lifetime. This Memorial Scholarship means the world to me. And it actually gave me the confidence and, as I mentioned earlier, the motivation to become more knowledgeable about the mental health issues that are impacting our society. And I hope to establish a lifelong relationship with MEDA and continue to learn about the strategies and techniques you need to help people overcome eating disorders. Truthfully speaking, there are a few different stigmas about mental health and prevent people from getting access to the care. First, we have public stigma, in which people in general just have negative views about mental illnesses. And next, we have self-stigma, in which the person themselves, have internalized shame or they're just embarrassed about the mental disorder. And we also have institutional stigma, in which the organizations intentionally or unintentionally just minimize health services for their employees or anyone that's a part of the organization. But I feel that most stigma about mental health comes from the lack of understanding or fear. Stigma also stems from inaccurate or misleading information about mental health. And it really has a tremendous impact on, if people seek treatment. Public stigma is perhaps the main catalyst behind the discriminating attitudes that prevent people from seeking mental health services. Many people, they accept the genetic or medical makeup of a mental health disorder, and they also, they see the need for treatment, but most people still have a negative view of people with a mental disorder. It is up to professionals, mental health professionals like us, to help spread the truth about mental health so we can change the stigma that prevent most people from seeking care for their mental health disorders. In the future, I will become an interventionist and great communicator in the field of mental health. I will share my knowledge about mental health with marginalized and oppressed communities with little to no knowledge about mental health or how to seek treatment. Additionally, I am motivated to plan and host wellness seminars for all populations that have been impacted by mental health illnesses and have limited access to treatment. My mission is to provide resources and normalize mental health conditions, as well as enlighten people on the importance of seeking treatment when they start experiencing symptoms that are impacting their daily functioning. After receiving my doctoral degree from Hampton, my vision for the future entails advocating for mental health access and treatment in low-income neighborhoods and across the country. My goal is to collaborate with organizations like MEDA in an attempt to educate people about the stigmas of mental health. I hope my altruistic endeavors help people learn to cope with mental health disorders and provide them with the services they need to move forward in life. I chose a profession in the mental health field because of my family's struggle with mental disorders, specifically anorexia nervosa for my sister and binge eating disorder for my uncle. And also because of my passion to help others understand the importance of seeking treatment when you are experiencing symptoms from an eating disorder or any mental disorder. My personal connection for eating disorders date back to my teenage years, when I witnessed my sister constantly eating small amounts of food, restricting foods, and only eating small amounts of foods when we went out to restaurants. I can also recall my sister being preoccupied with her weight and afraid to gain any weight. Unfortunately, due to the stigma of eating disorders only affecting certain cultures, my sister was not properly diagnosed by her PCP, therefore she did not receive the treatment she deserved. I am thankful to God that my sister did not commit self-harm, because suicide is one of the leading causes of death for eating disorders. My family's connection to eating disorders also include binge eating disorder. My uncle battled with eating unusual amounts of foods in our presence for years and never seemed to be bothered by his behaviors. He would also eat fast and never seemed to be full at family gatherings. Just like my sister, my uncle did not receive the treatment he needed because his doctor did not think to screen for binge eating disorder. This is illustrative of the stigmatized problem that many doctors do not properly screen certain cultures for eating disorders. Instead, they just prescribe unhealthy diets. So my family accepted my uncle's abnormal eating behaviors because we felt like it made him happy and feel good about himself after his divorce. Little did we know that my uncle was going through depression and used eating as a coping mechanism. Eating disorders often occur alongside other mental disorders, such as anxiety, depression, and substance abuse, which is commonly known as a dual diagnosis. In closing, my personal connection to eating disorders arose when I was young and didn't understand the negative impact that mental disorders can have on families. Today, I'm an advocate for eating disorders awareness and treatment, and hope to be effective in people's lives now and in the future. Thank you.
Calvin, thank you so much. Your vision, your passion, your drive is completely unparalleled. And I have to tell you, we are so incredibly honored to support you in reaching your goals. And I don't know about you guys, he's going to knock it out of the park. Thank you. So for those of you who don't know me, my name is Monica Ostroff. I'm MEDA's Executive Director, and I am so thrilled to see you all here today. I know that every single person sitting here has a lot of other places that you could be. And the fact that you chose to be here this morning means so much to me, to every member of the MEDA team, and every person sitting on the board of our directors. So thank you so much for spending your time with us this morning. What Calvin just said about stigma is absolutely spot on. And we see it every single day at MEDA. He's 100% correct that the general public tends to view mental illness as this personal defect rather than the life-altering, life-threatening illness and disease that it actually is. And as a society, we tend to embrace this on a macro level in that we don't actually even bother to allocate funding for the innovative and accessible programs that we need. And that leads to exactly what Calvin just said, people feeling so embarrassed and so ashamed that they don't even come forward to seek help. This idea that eating disorders are like a diet gone awry and they happen to skinny middle-class women, sorry for the air quotes, but it's true, it is such a worn-out, old, defunct idea. They could not be further from the truth. Eating disorders affect everybody. Doesn't matter how old you are, doesn't matter what race you are, doesn't matter what your sex or gender is, doesn't matter what culture you come from, doesn't matter your ability. Nobody is immune. And eating disorders are deadly. You've already heard the statistic this morning, right? That every 52 minutes, somebody loses their life as a direct result of their eating disorder. So for every single one of you here today, if you have the average 30-minute commute to work, and you work an average 8-hour day, and then you drive home for another 30 minutes, 10 people have died in that time frame alone. Somebody's mom, somebody's son, somebody's brother, somebody's dad, somebody's best friend lost their life. And if somebody was lucky enough to survive, they spend their days filled with anxiety, fear, exhaustion, and despair. If you can imagine for a moment the harshest critic that you can fathom in your imagination, that harshest critic has taken up residence in their heads. commenting on every single thing they do, every single thought they have, and it torments them every time they approach food, which is at least 3, if not 6 times a day, right? Maybe more. It torments them with every single bite they take. Imagine that for a moment if you have not been personally affected. Imagine what that is like. And while that's happening, their family's just sitting there kind of helplessly wondering what they can do. How can we help? How do we save them? They have no idea. Imagine that helplessness, knowing that your family member could die. And if your family member's lucky enough to survive, he or she or they is absolutely tormented. Life can be better than that. And MEDA, with your help, yes, your help, every single one of you, is working really, really hard to turn that around. So let me introduce to you for a moment some people's lives who have been directly impacted.
Our society so stigmatizes bodies. And when I look at Instagram and TikTok and like all of these things, like there's always a perfect body.
Stigma has impacted my care very significantly.
I think the stigma it impacts every facet of recovery and resources.
I'm infuriated by like the amount of like messaging and stigma that's been like put on me through my life that got me to the point where I was like so critical and mean to myself all the time.
A lot of people who need services for eating disorders won't even seek them out because they're embarrassed or feel stigmatized by their symptoms.
Eating disorders are really complicated and multi-layered. They don't look the same.
I didn't identify as a person who struggled with an eating disorder. I thought I was just weird, and so I hid that part of me.
I got caught very much in the diet culture cycle.
It had just been like this secret that I'd had from the age of 14 to, believe it or not, 43 years old.
It's not just this like the eating disorder isn't in this little box and it's done. It affects how I work, how I'm in relationship, like how I move my body, how I, enjoy space and time, like all of that.
And it wants to isolate you and the family and the parents too.
It's nothing I would wish on anybody. It can be all-consuming.
It's not a choice. And even if it was a small choice at the beginning, it no longer becomes a choice. After time, it owns you. And it becomes a dictator and you do as it says. Otherwise, there are terrible repercussions.
How many just normal things in our society are disordered eating and can lead to a really dangerous life experience.
I knew I needed help. I knew I couldn't get out. And I knew I could eventually die if I kept progressing the way I was progressing.
When you're in the middle of the eating disorder, it's hard to be forward-looking.
I'm finally finding medical providers that I feel comfortable with and can have conversations about my actual health and not just my weight.
I think that stigma impacts treatment and access to resources by either explicitly or implicitly denying access to resources unless you meet the preconceived notion of what an eating disorder looks like.
I had my gallbladder removed and it took 3 days of excruciating pain on the ground in a fetal position because I did not want to go to the doctor and have them tell me that it was just something that I ate or that I needed to lose weight.
Everyone is entitled to equitable health care, but yet when you live in a larger body and you go in, the first thing you're going to be is shamed about how your body looks. Part of MEDA's original mission was actually around increasing the awareness of eating disorders and helping people understand that eating disorders don't discriminate. One thing I think MEDA is really good at doing is thinking out of the box. So we don't have one specific treatment modality that gets applied to everybody across the board.
MEDA has been a life changer. It's a fantastic resource. The people are great. The community is great. The programming is interesting and varied. The flexibility of meeting people where they are is amazing.
I'm just so grateful for MEDA.
Her recovery began in significant part because of the resources that we found through MEDA.
There's a couple wonderful resources that MEDA has provided for me. The most prominent one being the online group, and that has been a lifeline for me.
I support MEDA because I love their mission to support everybody in recovery.
Improving access to care is part of MEDA's mission and vision. And we actually do that through kind of a multi-lens or multi-pronged approach. Yes, we absolutely have things like scholarships for services. We have the online recovery community. We have group programming, individual services. But we also train clinicians.
Being comfortable in your body, I think, is really important. I don't think we really talk about it enough.
In order to be there for someone, you have to be healthy yourself, and you need to take care of yourself.
I think back to where I was 5 years ago and the person I was then, and I'm like, wow, that's like a completely different person than I am today.
This is a journey. Recovery is possible.
It's a little unfair that I now have to talk in front of 150 people while I'm crying, but okay. I know so many of those people, and I first have to say, first of all, thank you to every single one of them for sharing their raw, authentic selves. And now, to all of you, I say, are they not amazing? It's incredible the work that they have done to change their lives, to get free, to get their lives back, to feel better. And I have to tell you, we are so incredibly honored to be able to help them, and we've been able to do that because of your support. So I hope that when you got to the end and you watched them talking about all of the good things that they have in their life now, whether it was Rachel saying wow, I'm a totally different person now, or Kim saying recovery is possible, you also feel good about that because you helped them get there. So thank you, each and every one of you, for helping us do that and for helping them do that. It means a lot. Actually, speaking of help, I would like to take a moment just to thank our partners for treatment centers. We have actually some mutually supportive relationships with treatment centers across the country, and their dedication to providing compassionate, expert care is really unparalleled. And the fact that they have been able to literally take every single challenge that COVID and the pandemic threw at them and still roll out some really incredible care is beyond impressive. And their innovative programming is so incredibly important to people struggling. So please, with me, I'd like to thank our platinum partner, Walden Behavioral Care. Also our gold partners, the Renfrew Center, Monte Nido, Timberline Knolls, Equip, Within Health, and Galen Hope. All of you are amazing treatment center partners working very hard every single day to help people turn their lives around, and we thank you from the bottom of our hearts for partnering with us. So we talked a little bit about stigma already this morning, right? And how stereotypes create shame and embarrassment and ultimately impact a person's ability to access the care that they need to get better. And I want to take a moment to just dispel a couple of myths. So this idea, it's true, right? Anorexia nervosa happens to be the eating disorder that tends to have the highest mortality rate. But it's really important for everybody here to know, and preferably everybody in the entire world to know, that it is by no means the only eating disorder. And it is certainly not the only eating disorder from which people are dying. Let's think about that for a moment. People have falsely assumed, right, that in order to be like really sick or that we should be really worried about you, that you have to be really underweight. And that is false. Some of you may know that I'm kind of a fossil in this field. I've been working in the field for 30-ish years. And in the 25-ish years that I have been a licensed clinician treating people, I have to be really honest with you and tell you that a person's size and shape doesn't tell us anything at all about whether or not that person has an eating disorder. You can't look at somebody and be like, you have an eating disorder. We don't know that by looking at someone. And some of the sickest people that I have treated in my career, and some of you know I used to lead higher levels of care. So I worked at residential, I've worked in inpatient, all of those levels of care. Some of the sickest people that I've treated actually live in average or larger sized bodies. And we have folks in average or larger sized bodies who don't even get screened for eating disorders, mostly because of that worn out stereotype that I was talking about earlier. Their body doesn't look like that stereotype. And yet, they're engaging in the same unbelievably dangerous behaviors that we hospitalize thin people for. So we basically have people living in average and larger sized bodies. They go into their doctor's office and their doctors immediately say, you need to eat less and you need to move more. When really, they should be told to eat more and move less, because they are already starving themselves and they're already in perpetual motion. And they're dying. And they're suffering immeasurably. Let's talk about the fact that Black, Indigenous people of color are half as likely to be diagnosed as their white counterparts. And we already heard that from Calvin this morning with his sister, right? Didn't even get diagnosed. Their physicians actually don't even think to ask them about eating disorder symptoms. And did you know that Black teenagers are 50% more likely to suffer from bulimia nervosa than their white peers? Or did you know that Hispanic people are significantly more likely to suffer from bulimia than their white peers? We do not have equity right now. Eating disorders are not about perceptions of too much or too little food, too much or too little movement, too much or too little texture. They're actually about human beings desperately trying to find ways to survive their life, to get through the challenges of their life, to cope with stress, to cope with overwhelming emotions. And they're caught in this really complex interplay of genetics interacting with their environment, while the $72 billion diet industry sells us all a problem that we can't fix. And people are suffering, and people are dying. And we really, really need your help to change that. I now have the very special pleasure of introducing you to two incredible MEDA community members. First, we're going to hear from Dr. Mary Lyons-Hunter. Dr. Lyons-Hunter is a clinical psychologist and the unit chief of the Behavioral Health Department at the Massachusetts General Hospital Chelsea Health Center. Her clinical work for the last 20 plus years has focused on the treatment of poor and underserved communities. Her clinical interests are anxiety, trauma, and major mental illness with adults and children. She has consistently sought ways to increase access and creatively deliver services to those most in need in our communities. She has worked to develop programs and care delivery systems to address both clinical needs and social determinants of health. She has participated through the years in many community-based research projects with MGH, MGH Pride, Cambridge Health Alliance, and Boston Medical Center. And after Mary, we will hear from Jen Foundis. Jen is a mother and wife who has worked in education for more than 20 years. She advocates for all, especially those struggling and facing hardships with stigma. This commitment stems from Jen's own struggle with anorexia. And right now it is my immense pleasure to introduce you to Dr. Mary Lyons Hunter.
Good morning. It's wonderful to see everybody here today in support of this transformative organization that we know as MEDA. For those of you that read news sources, access social media, watch television, you're keenly aware that we're in what I refer to as the second pandemic, a mental health crisis. The increase in mental health disorders has been rising steadily for years. In 2008, 17.7%, or 40 million Americans, particularly adults, identified as having a mental health disorder. In 2020, the rate was 21% of the adult population with the rate of what we call AMI, or any mental illness, jumping to 41% in 2021. And this was done by the Kaiser Family Foundation that did this research. This is 53 million adults are identifying with some form of mental illness. 1 in 6 children, now if you think about all the kids that you all encounter, 1 in 6 are currently identifying with AMI or any mental illness. And according to the Kaiser study, the largest cohort reporting depression and anxiety were the 18 to 24-year-olds at 56%. With that being said, only 46% of people with mental illness received care in 2020, 46%. There are approximately 525,000 people licensed in the United States to deliver mental health care. That's less than 1% of the population. 46%, 1% doesn't match. Give you an example. If every licensed psychologist in the United States provided therapy for 50 hours a week, which anyone that does this work knows that's not possible, we would still only meet 15% of the demand. We're in a crisis. We're in a true crisis. My anecdotal experience managing a community mental health clinic bears this out with a current waiting list of 800 adults and children. 800 people, family members, suffering. Your kids are suffering. I can't get them in. I feel like the bouncer. All day long, that's just what I do. I'm sorry I can't. I'm sorry I can't. And not to be overly reductionist, but I would like to briefly address just a few aspects that I see as causal to this increased need. The COVID-19 pandemic has upended all of our lives in ways that we could not have even imagined. With the flip of a switch, our lives changed. I've spoken to many people who are well-resourced, have family and social supports, and they have been struggling with anxiety and depression, because we have been. But imagine if you didn't have resources, if you didn't have food or other social supports. I'd like to mention that particularly during the pandemic, that MEDA sent grocery gift cards to clients in need because there's a very strong link between eating disorders and food insecurity. Thank you, MEDA. For many, their supports and resources were tenuous pre-pandemic, and the pandemic took away what little they had. The isolation, the fear, the loss, and grief for many has been profound. We can also add financial burdens, political climate, and global unrest to the list of stressors. Isolation and quarantine increased individual stress as well as stress in families. Our traditional social anchors, holiday gatherings, hanging out with friends, family gatherings, going places, socializing, were taken away, leaving many alone and afraid. These increased mental health concerns have reached the level of the federal government. President Biden has put forth a plan investing $1 billion in boosting mental health care system. Many question, is that enough? Is that enough money? I question, is that enough just to add mental health care services, or do we need to look beyond? My career has been providing care to an underserved, primarily immigrant and refugee population, and this is my clinical lens. These marginalized populations are suffering at a much higher rate due to not only the enormous impact of COVID. Chelsea, the community that I work in, was one of the hardest hit per capita in the state, and it was devastating. but also the remaining sequelae of the pandemic. How can I help a parent with depression if they're struggling to feed their kids? How do you manage adolescent behaviors if the parents are absent? They're working 2 jobs, leaving the children unsupervised. How do you help a child with anxiety, depression, or an eating disorder when their parents are working and they're being left with a babysitter, or more likely alone every night? How can we help young adults when they can't find jobs that pay enough to allow them to self-support, or the young adults that see a bleak future for themselves due to rising costs, climate change, the rise in racism and other isms, and the volatile political climate? All of these social, cultural failures lead to mental health diagnoses, which need to be acknowledged and addressed before we can treat or manage the mental health crisis. This crisis comes from some place. It doesn't just appear. These are the things we don't attend to. One population that continues to rise at a remarkable rate are youth with eating disorders, and I'm going to be somewhat redundant here. In 2018, 7.8% of the population had an eating disorder. 7.8%, that's a lot. 28 million Americans will have an eating disorder within their lifetime. That's 608,000 in the state of Massachusetts, our tiny little New England state. There's 1 death every 52 minutes, and people of color are half as likely to be diagnosed. In 2020, there was a 66% increase in eating disorder admissions to hospitals. That's an enormous number of people. These are our family members, people that we care about, or someone cares deeply about. The isolation of the pandemic created great struggles for those who were already diagnosed and contributed to the growth of more being diagnosed. Being at home was the catalyst for unhealthy coping strategies and lack of access to supports. In a world that feels out of control, the need to control something becomes enormous. It is well documented that ethnic disparities influence access to mental health care, treatment, and outcomes. It's even more prevalent for people with eating disorders. The diagnosis of eating disorders has not always kept up with the standards in more affluent and white communities, despite the high rates of eating disorders in Hispanic, African American, and Asian populations. Not only do we see less diagnosis, but also less treatment opportunities for our BIPOC populations, and this is a worldwide phenomenon. This is a systemic failure driven by such things as lack of cultural awareness, lack of providers that match the patient's ethnicity, patient's apprehension to disclose or seek professional help, distrust in the healthcare system. We hear that a lot, actually. Affordability of eating disorder-specific care, and also importantly, the stigma associated with eating disorders in many families and cultures and other social environments. As with other mental health diagnoses, we cannot separate this diagnosis from environmental and societal messages. Our youth and young adults are inundated daily with messages about body image, diet culture, food behaviors. Society for years has focused on women's bodies and influenced the standard for beauty and health. The literature is rife with references to Western culture and the emphasis on body image, leading to a higher prevalence rate of eating disorders. Many of these messages are overt: diet pills, food plans with pictures of happy people and thin people, television and movie celebrities with fit and toned bodies is held out as our standard. Some of the messages are more subtle: low carb, low fat, labeling as good foods and bad foods, the medical community that measures weight when it's not relevant to the problem you're seeking help for. And the guilt and shame around these topics weigh heavily on those that are most vulnerable and impressionable. Sadly, the Western media has erroneously coupled happiness, health, and worth with thinness. Thus, we are brought into and allowed the media to affect our health and well-being. Eating disorders are fatal. They are the second most frequent mental health causes of death behind opiate overdoses. Everyone's talking about opiate problems. I don't hear the same language about eating disorders, and they're just as deadly. So now that I've painted such a grim picture, sorry to start your day off on such a happy note, what can we do? What can we do? First of all, healthcare systems need to find ways to create more awareness regarding the diagnosis and treatment of eating disorders. We also need to support BIPOC individuals that wish to become mental health providers like Calvin, not only with financial support, such as MEDA has done, but also with mentorship. We need to urge our communities to recognize and address social determinants of health in our communities. We need insurance companies to understand the true cost of providing mental health care and compensate providers accordingly. We also need to support those elected officials, I'm looking straight ahead, and those running for public office that understand the impact these issues have on our communities and our economy. All those 66% of people that were in the hospital, they weren't working. These things affect our economy. These things don't happen in a vacuum. Although the data are grim, we must hold hope. All of you here have the power to make a difference, be it coming to a MEDA Breakfast, be it through your workplace, be it through the voting booth, or by supporting organizations that are committed to caring for others, such as MEDA. Thank you. So eating disorders do not discriminate. They cross all socioeconomic and cultural boundaries. Our family was not immune. Years ago, and thanks to MEDA, my sister found strength and determination to overcome her struggle. And it is with great honor and pride and a few tears that I introduce my most amazing sister, Jennifer Fondas.
I always have a no tears in the workplace rule. I suppose this isn't my workplace, so I can let them flow. So I'm just trying to find my papers up here. That's okay. Trying to get through the piles. There we go. Good morning, everyone. My name is Jen Fondas, and I'm here today because of MEDA. Not just because they asked me to speak, but more importantly, without the services they provide, I truly believe, actually I know, I would have died from my eating disorder. Looking back, I always had a weird relationship with food. I remember being in high school and comparing myself to my friends. I decided that I needed to lose weight before a senior trip to the Bahamas, and I ate Ringo noodle soup exclusively for about 2 weeks. Why I thought that was a good idea, I don't know, but that was the path I chose. In my early 20s, I got on a vegetarian kick. Most days of the week, I would stir fry zucchini and eat it with brown rice, and I didn't see anything wrong with this. I thought I was trying to be healthy. I didn't see that I was restricting. I never thought of any of this as disordered eating. I just thought I would get into these weird food kicks again and again and again. Well, in August of 1998, my life turned upside down. My high school boyfriend, who I had been with for 8 years, called off our wedding 5 days before the event. I've said for decades now that he did me a favor, but at the time, it impacted me in so many ways. I thought of myself as worthless. I no longer trusted myself because I couldn't believe that I didn't see it coming. I felt like I had no control over any aspect of my life. For months following, I struggled with anxiety and depression. My whole life was spiraling. I sought comfort, control, and something I could depend on that no one could take away from me. This led me to food restriction, diet pills, and laxatives. And I'm going to be honest with you, when I say food restriction, I mean starvation. Anorexia took a firm hold on me in a very short period of time. Eating disorders are wildly misunderstood. In my opinion, there is no other illness people feel so free to comment on. When I first started restricting, everyone would comment on my appearance and my weight, telling me, "Wow, you look great," or "Oh, what is your secret?" Little did they know that my secret was my anorexia. Those comments to an eating disordered brain further fueled the grip anorexia had on me. It reinforced that I was doing something right. It reinforced my need for control and my need to be seen. But this quickly spun out of control for me. There is a tremendous stigma surrounding eating disorders, the help necessary, and the recovery process. I've thought about this phenomenon for years, and I always end up with more questions than answers. Why do people feel that they can comment on your appearance or what you're eating? The fact that people told me I was looking good in the beginning, even though I was struggling and dying inside. I was slowly killing myself. But to everyone else, I looked great and should keep doing whatever I was doing. It makes it hard to cry out for help or to even recognize you have a problem when other people's comments are reinforcing your eating disorder. Before I go any further, I need to say that I know there is no malicious intent on people's parts when they make comments. They don't understand that making a comment further promotes the stronghold the eating disorder can have. Later, when it became apparent that something was wrong, very wrong, I was not well, but comments still ran abound. But this time they were, "What's wrong with you? Why don't you just eat? Oh, I love food way too much to possibly do what you're doing." Now, instead of the comments that heaped praise and the accolades in the beginning, I was met with disdain and disgust. My road to recovery did not start because of other people's comments. These are not helpful at all. Instead, they continue to reinforce the stigma around eating disorders that there is something wrong with the person, rather than the person is sick. My anorexia became my best friend, my confidant, and my sole source of comfort for a very long time. But like I had experienced before, my anorexia betrayed me. My body started breaking down. I was no longer finding joy in life, and I couldn't go on like this. I have many blessings in my life, and one of them is my proximity to MEDA. My primary care doctor told me about MEDA, and he said the fact that I lived 2 miles away from the office must be a sign. "Please reach out," he said. I remember my first intake meeting at MEDA. I was still unwilling to admit just how sick I was, but the clinician was so kind and understanding. She told me about the support and services they could offer me. She never put any pressure on me and never made me feel like there was something wrong with me. I finally felt heard and understood. I was connected with a wonderful therapist, a nutritionist, and a support group. My therapist had recovered from an eating disorder herself, and I finally had somebody who understood me and was a role model for my recovery. I looked forward to my weekly support group meetings. Hearing that I was not alone was crucial in my recovery. There was one activity that took place in support group, and it was a light bulb moment for me. We were given large pieces of butcher paper, and told to make an outline of our body. Then we laid down on the butcher paper and traced ourselves. When I stood up, I remember gasping. It was at that moment that I realized my eating disorder completely changed my perception of myself and created an alternate reality. How I viewed myself was nothing like the reality of my body. I knew I was sicker than I cared to admit. Shortly thereafter, I was hospitalized to receive both intensive mental health support and medical stabilization. I remember my mom, who's sitting right there, bringing me along with my sister-in-law, Anne, and my mom asked the intake nurse, is she going to be okay? I mean, she's not going to die, right? The nurse told my mom that she couldn't answer that, but they would do everything they could. The look on my mom's face still haunts me. Thankfully, my hospital stay helped me get out of my acute medical crisis, and I continued with all the supports and services that MEDA provides. I stand before you today, more than 20 years later, a mother to 3 children, a wife, an educator, and an advocate. I have a wonderful and supportive family and friends, and none of this would have been possible without MEDA. Prior to accessing their services, I was at a fork in the road. If I had not chosen to go down the path of recovery, I would not be here today. Thank you, MEDA, for saving my life.
You two are amazing. Thank you so much, Dr. Lyons Hunter. Thank you so much, Jen. It's so nice to hear how you're doing today, too. Really, really amazing. So, y'all, we got a lot of work to do. You know that just from hearing everything that we've said today. But we have plans, and I want to share a couple of them with you. So, it's really, really clear, right, that we need to, we're actually in the process of expanding trainings for professionals. The days of referring people specifically to eating disorder specialists are gone. There are too many people in need. There are people dying, waiting for spots to open up. We have to do something right now. So we have trainings. We got to get tools and services to centers just like Dr. Lyons Hunter's. The trainings can be both in person, online on demand. MEDA's the organization to deliver that, in my somewhat biased opinion. We need to continue expanding our clinical services, that's really clear. And actually right now, I want you all to think about the fact that the holiday season is coming up. It's literally the most triggering time of the year for folks with eating disorders. And we have some special holiday groups and skills sessions for them, some chats, just helping them navigate this incredibly difficult time of the year. We really need to expand our staff. In Massachusetts alone, we have 608,000 people that suffer with eating disorders. Help us help them. Our 24/7, 365 recovery community has grown 350% in 8 weeks. That's it. 8 weeks, 350%. We have 1,000 people accessing those services for free. In January, we're going to have 2,000. In March, we're going to have over 3,000. They can't get these services anywhere else. So it's really imperative that we are able to create an accessible, discrete app to ensure that these people have access anytime, anywhere. If you've already donated to us, I want you to know that your contribution has helped to directly treat the people, some of whom you saw today in that video, and guide them through recovery. Your contributions have helped ensure that we have space in our groups. It's helped provide phone support. It's really been incredibly supportive of us, and we are really grateful. But truthfully, the time is now. We need you now. Help us help the 1,000, soon to be 2,000, soon to be 3,000 people in the MEDA recovery community stay alive, heal, and thrive. Help us make sure that while you're at work today, somebody else doesn't have to die. Help us make sure that people and their families can access the care and resources that they need and deserve. You have the power to make a difference. So if you would like to help make recovery possible, we have a number of ways that you can do so. You'll notice on your table in your program, there's a QR code. You can donate to us by credit card or PayPal. You can fill out a donation card that's on the table or write a check. We have MEDA clinicians, Jen and Darcy will be at the doors to collect them as you leave. I truly cannot thank you enough for sharing your morning with us, because we really can't do what we do without you. Thank you so very much for the morning, and thank you for your continued support. We wish you all the best and thank you for being in our community.